So let's dive a little bit deeper into that. Just some statistics. About 27 million Americans are experiencing thyroid disorders, according to the American Association of Clinical Endocrinology, right there. Approximately 80% of those people are female. So out of 27 million Americans suffering with thyroid problems, 80% of them are female. It's actually more, it super exceeds diabetes by 40%. 40% more people are diagnosed with thyroid problems than diabetes. How you doing, my friend?
Good, how are you?
I'm good. Have a seat anyway. So that's how prevalent and how common thyroid problems are. And most of these problems that sometimes can go misdiagnosed. And we'll talk about that more in detail. So some of the common side effects or symptoms of thyroid. Does anybody know some of the symptoms of thyroid problems? You shout out the problem like insomnia, cold, depression, overweight, you can't lose weight, thinning of your hair. You basically are like confused, brain fog, lack of energy, feeling fat, and sometimes swelling of the thyroid itself. And there is a reason. I mean, it's not like there is a reason why your thyroid would swell like that, because it needs something. And we'll talk about that in a second. Thinning of your hair and so forth, dry skin. So if you notice, some of these symptoms might be confused for other reasons, or sometimes also could be caused by other problems. So let's dive a little bit more detail into that. So it doesn't really matter where you're at when it comes to what you've been diagnosed with or what you've been told. There is still a chance and there is still hope, because we've seen worse of the worst. When it comes to thyroid, especially with the Wellness Way approach, we've seen worse of the worst, and we've been able to reverse and manage thyroid problems without medications. So let's dive into that a little bit deeper. Why is thyroid a big problem? I mean, when they remove the thyroid, do not opt in for removing your thyroid unless it's a last option, or if it has cancer or something like that. Because it does a lot of important things in the body. Regulate digestion, oxygen consumption, and mobilization of fat. It helps control body temperature by regulating heat and energy production. In children, it helps growth and it impacts their IQ. It has a profound impact on mood and emotions, play an integral role in your immune system. Now, one of the biggest things with thyroid, it actually regulates your metabolism. And that's why you see people like they can eat whatever and they burn it and they don't gain weight. But let me ask you this. Would you rather have high metabolism or low metabolism?
High.
Exactly, and that's what a lot of people want, but that's a wrong thing. Because you know why? If you have high metabolism, if you have a car that you drive the car at 120 miles an hour versus you have another car that you drive the car at 60 miles an hour, which one is going to go back first? Which one is going to go first? 120, because you're going to just burn that car. So you want high metabolism, especially in the early stages of life, but the late stages of life, you want your metabolism to be steady and constant. I mean, the metabolism, it fluctuates based on your body's need, but you do not need high metabolism, because we think metabolism is digesting the food. But now, metabolism is how your body and how your cells are functioning on a daily basis. So if your cells are working extra hard and functioning a lot harder than they should, they wear out faster, and that's what leads to you grow older faster, and then eventually you die sooner if you have that high metabolism. But you want your thyroid to manage that, your metabolism level. So like high metabolism does not always equal good health, even though it may actually feel thinner and skinnier, but that doesn't always mean good thing. So you don't want high metabolism at all. Now, when you go to your doctor and they check your thyroid, what do they check for?
Total
Yeah.
thyroid test, TSH, FSH.
Okay. Yeah, TSH is one, and T3 and T4 if they're very optimistic. But they normally check for TSH. That's the biggest thing they check for. Do you know what TSH stands for? It stands for thyroid stimulating hormones. And if your TSH is off, they give you medications to manage your TSH. But did you know that TSH itself is not even a thyroid hormone? So they want to check the health or the function of thyroid by checking a hormone that's not even produced by the thyroid. This hormone from its name, it's thyroid stimulating hormone that it stimulates. It's actually produced by the pituitary gland in your brain to stimulate your thyroid to make or produce thyroid hormones. So, and we'll go into that anatomy in a little bit. So, like I said, it's not even a thyroid hormone, and if there is something, if it's off, they'll give you medication, and you might end up, even if you're taking medications to manage your TSH, you might still have some thyroid problems or thyroid-like symptoms. And now when you go back to your doctor, it's like, I still feel depressed, I'm still gaining weight, I'm still losing hair, I can't sleep, what's wrong with me? And they do another test and you're taking the medication, oh, but your TSH is normal, it's not your thyroid, let's put you on antidepressant medications, let's put you on medications for sleep and so forth. So TSH does not tell the whole story. This is the thyroid, that's what it looks like. It's a gland that sits right there, and that's where, like sometimes when you have a swelling in the thyroid, or you have goiter or nodules right there, it could actually swell up, and so you can't swallow, and it's hard to swallow, and so forth. So that's where the thyroid location and so forth. And one of the things, like we said, it manages your body temperature and metabolism. So you want the temperature to be 98.6, right? That's what the average. But that doesn't really have to be true because everybody's different. Like even twins could have different temperature, but it doesn't have to fluctuate too much. But 98.6 is an average, and that's what the thyroid does, manage it at that. Like I said, if you have two glasses of water, and one of them is warm and one of them is cold, and you put salt in there, which one is going to dissolve faster? The hot one, right? And that's what you don't want. You don't want high metabolism because that's you're going to grow older faster. So you need to know what's behind the whole picture of the thyroid. Why the thyroid is a very important gland, because the thyroid produces hormones that are important for every single cell in your body. And if those cells do not get these thyroid hormones, those cells can actually die. So that's why thyroid is a big problem. I mean, a big deal, because you can't, like I said, do not opt in to remove your thyroid unless you really, really have to. And what you're going to see later on is even if they remove the thyroid, they give you medications that only produce one kind of thyroid hormone. And we'll see later, thyroid produces between 5 to 6 different hormones. And what's interesting about the thyroid produces these hormones throughout the day based on your need. Based on your need. They fluctuate, they go up high one time and they might drop and so forth throughout the day based on what your body needs. Now if they give you medication to take for your thyroid, those medications cannot go through that cycle. It's one tablet or one medication throughout the day and that's it. It doesn't have that, it doesn't meet the demand of the body. And they only give you one type of hormone, and that doesn't cut it because the thyroid itself makes, like we said, 5 to 6 hormones. So find the warrior, arm yourself with the knowledge and so forth. This is one of my favorite concepts in the wellness way is the concept of the wellness of the fireman versus the carpenter. If your house is on fire, who are you going to call? The fire department. And now the fire department are going to show up with 2 tools. When they show up with 2 tools, the axe and the hose, they're going to try to put off the fire. The guy with an axe is going to break the windows, break the glass, and or the doors to get inside the house. And the guy with the hose is going to go in there and spray the walls, to put off the fire, right? And that, now, after they put off the fire, they look at it and they look at the house and they, tap themselves on the back like they did a good job putting off the fire. Now, if there is no chance of another fire in this house, would you ask the fire department to stay around and rebuild the house? No, it doesn't make sense, right? Especially with the tools they have, the axe and the hose. But thanks God, we had them there on time because research shows if they got there on time to put off the fire, it's a lot cheaper to rebuild the house from here than rebuild the house all the way from the ground up. But now, if you move into this house, is it toxic?
Yeah.
Would you actually get sick if you move into this house?
Yeah.
Can you live in this house?
No.
Possibly not. So you need to get a good carpenter to find out what's going on, and the carpenter is going to show up to the house and go, oh my gosh, what a mess. I need to replace this door, I need to replace this wall, I need to do this and this, and to rebuild the house. So you need a good carpenter to help you rebuild your health. Because you can't rebuild your health with drugs and medications. You can't. Drugs and medications are good and important when you need them, but not to rebuild your health. Does that make sense? And what is one thing that's common to all medications?
Side effects.
Side effects. I mean, who said, did I say that? Or it's like, if you see the list of side effects in every single medication in the back, the list can go on and on and on. But like I said, thanks God we have them when we need it. If somebody drops down with a heart attack, I'll be the first one to call 911. Same thing, Greta, that might be like, it's gonna get warmer there.
I know.
So you might always move up, like take one of the chairs right there. So, and we'll talk about autoimmune diseases and how they impact and influence your thyroid. And we'll talk about that in more detail. And it's actually, if you, I think I have the research where it says autoimmune diseases are the #1 cause of death in female Americans between 20 and 40 years old. Autoimmune disease. Sometimes we don't even know what autoimmune diseases are and what could be caused by. Now, when it comes to the wellness way approach, it's like we'd rather find out what's causing your thyroid to be out, what's causing your thyroid to be a problem, or not producing the hormones and so forth. So, for example, if you have a thyroid problem and you go to your medical doctor, they test your TSH, which is your thyroid stimulating hormone, and based on that, they give you medications, either to lower TSH or increase your TSH and so forth. Versus, and that Synthroid is one of the most prescribed medications for thyroid problems. But when it comes to those medications, one of the biggest contraindication for thyroid medications is if you have adrenal problems. So like if you go to your doctor and your doctor prescribes you thyroid medications and they never checked your adrenal, if you have adrenal fatigue or problems with your adrenal, they should not be prescribing you thyroid medications, because that's one of the contraindications of thyroid medications is adrenal problem. And that's not me saying that, that's on the medication itself. And the other thing that we're going to be talking about later is the other things that you're not supposed to be consuming or having if you're on thyroid medications is soy. Because soy actually destroys your thyroid, and we'll talk about that in a little bit as well. So like vegetarian or vegans, if they consume a lot of soy, especially the genetically modified soy, it's one of those things that could actually damage your thyroid. And so we have to check the adrenal, because you cannot talk about thyroid without talking about the adrenal gland. They are side by side. If you take a look at this patient and this test, the normal test for the patient, if you see the green right there or blue, you see that's what a normal level of the adrenal or cortisol, which is your stress hormone, is supposed to be. And if this patient is up there, that means they are very active. Those are the people that actually feel tired throughout the day. They feel tired, but they cannot go to sleep. Have you known somebody like that? They feel tired. I'm exhausted, I'm tired, but I can't go to sleep. If I go to sleep, I can't even close my eyes. And this is, if the level is lower like that, those are the people that cannot even get up in the morning. I mean, even though they slept throughout the night, but they cannot get up in the morning. So you cannot take any medications for thyroid problems if you have adrenal problems. And also, is to manage your thyroid, you have to make sure that your adrenals are functioning properly. Okay? This is really how the thyroid works. And this is what that TSH comes from and so forth. So you have your brain, which signals that TRH signals the pituitary gland to start producing thyroid stimulating hormones. Thyroid stimulating hormones go to your thyroid and tell your thyroid, hey, we need hormones. Now the thyroid is going to make those hormones. Mostly the thyroid is going to make T4 and T3. Those are the two hormones that the thyroid makes. But here's the interesting thing. 90% of the hormones that the thyroid makes are T4. What do I mean by T4? It's a hormone that is inactive. 90% of the thyroid hormones are inactive. That means if they get to the cell, they have no function at all. They have to be converted into T3. And that's the active form of the thyroid hormone. Now, 90% of them here, 7% of the thyroid hormones that are produced are T3. Only 7% are active form of thyroid hormone that can actually go to the cell and influence the cell right away. And we'll talk about the other ones. There's T1 and T2, and that's the other 2% of the thyroid hormones. And we're not going to dive into that today because that's going to take us 3 hours to just dive into T1 and T2. But we're going to focus on these two. Now, how does this negative feedback loop works? Let's say that your body has a lot of thyroid hormone. Let's say the body has a lot of T3 and T4, right? Now the body does not need any more T3 and T4 because if you have a lot of T3 and T4, that could be problematic. You'd be hyperthyroidism, like that's the opposite of hypo. Hyper, you're too much thyroid hormones in there. And in fact, if you have too much thyroid hormones, that could be a big, big problem because they use that, I don't know if they use that medication anymore. They used to give patients an active form of T3 that was like an injection for T3 that actually exploded the aorta. Like if they give them too much of it, they used to give them only in the hospital. So like, and how did they figure that out? Do you know how they figured that out?
Several people died.
Exactly, that's how it is. Several people died. So if you have too much T3 in your body is smart. And one of the hormones that actually the thyroid makes, it's reverse T3. And the purpose of reverse T3 is if you have a lot of T3 in the body, that reverse T3 is going to go and dock on the cells to fight with T3 to kick T3 out from actually entering the cells. From entering the cells. So if you have a lot of T3 and T4 in your body, now your body's going to send signals to your brain, telling your brain, hey, we have enough T3, we have enough hormones, stop making hormones anymore. So now we depress the production of TSH. Now the thyroid gland is not getting signals, is not being told to make more hormones, so it stops making hormones. So now, you see, like, for example, let's say that you went to your doctor and you actually measured that your hormones, your thyroid hormones are low. Your T3 and T4 are low. If they're low, there could be several reasons that you're actually, let's take T3. Let's take T3. If you can actually come up with 5 different reasons, or maybe even more. We can come up with 5 different reasons that your T3 could be low. 5 different reasons. Just looking at this picture, we could have come up with at least 5 different reasons your T3 is low. Can anybody guess which would be the number one reason? Like, it doesn't have to be like specific, in any specific order. One reason that your T3 would be low from just looking at this picture.
If the TSH or the TRH is not doing its job, or if the T4 is not getting converted to T3.
Those are 3 reasons right there. So like if the TRH or TSH are not firing and are not doing their job, or the T4 is not converted to T3, and we'll talk about all that. Why would that happen? Why would that conversion does not happen? And remember,
the gland itself is at fault. The gland is swollen, or something is wrong with the gland, and it's not producing.
Exactly, something is wrong with the gland. And we talked about earlier the autoimmune diseases. What kills? It's the #1 killer for female between 20 years old and 40 years old. Autoimmune diseases is where the body attacking itself. And one of the glands that go first is the thyroid hormone, the thyroid right there. So the body's attacking itself. And now with that, when you hear the term autoimmune diseases, what they say, hey, the body is just making a mistake attacking itself. No, the body's not making a mistake attacking itself, but the body never makes mistakes. Let's get that clear. I mean, the body does not make mistakes, but there is a reason the body's attacking itself. And we're gonna go over the triggers, why the body is attacking itself. We're going to go over those triggers. So we just like came up with 4 different reasons.
Or the pituitary gland itself is the problem.
It could be, yeah. Sometimes like it could be, you could have like cancer in there, and your pituitary gland is not working properly, and you need to investigate that. And you look at the other hormones that are produced in that area and so forth. So there could be like that's why I like the wellness way is like the CSI principle: investigation, 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 rather than just removing the thyroid because the TSH is not working properly. So that's how the hormone cycle works when it comes to the thyroid. And like I said, we did not mention the other hormones. We talked about T1, T2, and reverse T3, which are really, really important. And that's the medical approach. They would actually test TSH. And if you go to alternative doctor, they may actually test TSH and they test T3 and T4 to find out what's going on. And sometimes, there's a new medication they give you a pig hormone, like hormones from a pig. And like it's like your cells are different from a pig, literally, right? They should be different. So that should not work with our thyroid gland. It should be totally different. Like with bioidentical, like hormones, hormone replacement therapies, they're actually hormone from horses, and they give them to human beings. That doesn't like really add up, and that's why one of the side effects is cancer. Because the cells mutate faster and replicate faster because those hormones are intended for horses, not for human beings. Same thing here for pigs, which are maybe bigger than us. So it doesn't really add up. So these are the 6 thyroid hormones we talked about. And now when they give you medication to replace your hormones in your thyroid, they give you one, and that's only to replace that's Synthroid. They replace T4 only. But you have 6 hormones. Like we talked about T4, we talked about T3, and we talked about the importance of reverse T3, because to reverse T3, if you have too much T3 in your body, that's not good. We want to stop that from getting into the cells. And when they give you a medication, it only replaces one hormone, and that's T4.
Why T4? Why not T3? You said, like, percentage-wise.
Yes. Percentage-wise is 90% of the hormones are T4.
But it's not, it's inactive.
It's inactive.
It's a 7% of T3, which is useful. So just give 7% of T3. Doesn't that make sense?
Yes, because remember when you talked about they give these injections that has to be like, in a hospital, and when they gave too much T3, the urine exploded. Yes, so they don't give T3 because T3 is too much for the body. And that's why the body is smart enough to make reverse T3. We don't have reverse T4. We only have, the body is very smart to make reverse T3 to stop reverse T3 from damaging the body if it's too much. So that's only T4, and the body still can convert that as needed for your need. So now, like we said, when they test your T3 and T4, that's good, but it's not enough. So now, when we test your thyroid hormones, that's what we test for. There are 13 different markers, and all of these markers are important to give us a good understanding of what the thyroid gland is doing. So we're talking about TSH, total T3, total T4, all these, cortisol, which we talked about the adrenal gland. You can't actually test you can't work with the thyroid and give it any medications or anything to deal with the thyroid without dealing with the adrenal gland. And we talked about these antibodies, and those are an indication of autoimmune diseases. If your body is attacking itself and attacking the thyroid hormone, gland as well. Ferritin, if you're anemic, you cannot convert T4 to T3. You cannot convert, so like you could go get tested, and your T3 is low, and now your T3 is low, what are they going to give you? Medication. But what if T3 is low because your ferritin is not converted? Now, the conversion of T4 to T3, do you know where it happens? Most of the conversion, where it happens? There are 2 places where most of the conversion happens. The first one is in your liver. The first conversion place for that T4 to T3 is in the liver. I think about 60% of the conversion happen in the liver. So that's, if your liver is overwhelmed with heavy metals and toxins and so forth, that conversion cannot happen as easily. The second place where the conversion happens is in your stomach, in your gut. So if you have any gut flora imbalances, any infection in your gut, that conversion cannot happen. And like I said, if you're anemic, that conversion cannot happen. And there are heavy metals that could actually block the conversion of T4 into T3, and we'll go over those as well. But this here, when we look at that, that gives us a good understanding, a good picture of what's going on with the thyroid, or what needs to be done to address the cause of the problem. Is it autoimmune diseases? Is it anemic problem? Is it vitamin D deficiency? Is it stress from your adrenal? Where is the problem? Let's manage that and allow the body to do the healing. So that's thyroid binding globulin. Thyroid binding globulin is, if you look at, imagine a thyroid binding globulin are like a car. So you buy your thyroid makes T3 and T4. Those T3 and T4 have to be carried through the body into different cells, into different parts of the body, right? Now, these T3 and T4 have to be carried through the body into different parts in the body, right? And they have to be carried by these thyroid binding globulin. They, like the thyroid binding globulin are like a car, for example. They take those T3 and T4 as passenger, and deliver them into different parts of the body. If you look at this right here, elevated estrogen can raise those thyroid binding globulin. So we have a lot of them in there. So now they're holding on into T3 and T4. They're not releasing them at the cells. So now you get tested for your thyroid hormones. T3 and T4 are low, but the problem is not because your thyroid is not making enough T3 and T4, but because your body has a lot of estrogen, and because of that estrogen, we're elevated. We have an increasing number of thyroid binding globulin. Now you're holding on into T3 and T4 in your body and not releasing them. So they stay in the car and they're not being released. Does that make sense? How does that?
If you had a complete hysterectomy, your estrogens.
Yes, unless you're taking any hormone replacement therapies, and we'll talk about that. Yes. So your estrogen is, there is still some. It's not like completely gone, but it is still some. But it's still, unless you're taking hormone replacement therapies, which is going to be, if you look at what things that actually increase your thyroid binding globulin is estrogen, birth controls, and like the reason I said male problem, it's like, oh, do male actually take birth control? No, but actually, if your significant other taking birth controls, you actually can get exposed to them from just bodily interaction, like sex, for example, kissing, and so forth. That actually could be transferred to you. That's why I said male problem. Insulin problem could actually increase your thyroid TBJ right there. Hormonal replacement and bioidentical hormones, and like I said, soy could actually increase thyroid binding globulin. And soy and some vegetables, and like two things, like soy and corn. Soy and corn are substituted by the government. Like, the two things that like the government substitute for these, like soy and corn. And soy and some of the vegetables could actually cause problems like make thyroid bigger, goiter, and so forth. And we'll see some pictures right there. And I can, like, do you know, like, your body's not designed to digest corn?
Corn?
Yeah, your body's not designed to digest corn. Have you eaten corn? And then when you go to the bathroom, what comes out?
Corn.
Corn, right? Yeah. Corn off the cob, like you eat it off the. I mean, it's interesting, but like corn is like people. I don't have a problem with like organic corn, but if it's genetically modified corn, I mean, I like the taste of corn, especially with some good butter and salt. I mean, come on now. But like organic, like genetically modified corn, I try to stay away from that. But the body's not designed to digest it. I mean, you see it. I mean, it's scientific right there. So when you go to your doctor and they tell you, hey, when you talk about thyroid, nutrition is not important. Like you probably have heard, hey, nutrition is not important. You just need to take medications and so forth. Now, when you make hormones, when you make thyroid hormones, there are some nutritional components that are really, really crucial. One of those is tyrosine, and this is just to give you an idea what tyrosine looks like. So you have this molecule called tyrosine, which is amino acid. And on top of that, you have iodine attached to that tyrosine to make T3 and T4. And based on those number of iodine attached to tyrosine, that's what makes T3, you have 3 iodine, T4, you have 4 iodine. And reverse T3 is similar to T3, but one of the iodines is changing position. And I'm gonna just you don't have to memorize this, but it's just to give you an idea. So there are T1, T2, and now we're gonna make T3, which you have 3 iodine attached to that tyrosine right there. That's an iodine by itself. Those are like T4, T3s right there, and reverse T3, it just reversed one of those T3 iodine, one of the iodines. So tyrosine is non-essential fatty acid. It was discovered by a German scientist, and it's found in cheese, but also it's found in chicken, turkey, fish, almond, avocado, and all that stuff. So like if you have any thyroid problems, these are some of the things you should be consuming to actually help with your thyroid issues, because you need that tyrosine to help with the production of T3 and T4. The other thing is salt. You need salt. does anybody use salt?
Lightly, very lightly.
Very lightly, but you know, like salt is for the iodine to get through the cell membrane into the thyroid and to start making thyroid hormones. You have to have salt, which is that salt to help that transfer process to happen. For
Iodized salt?
Yeah.
it doesn't really like I like
Sea salt?
the sea salt. I like the sea salt, but it's the sodium. It's the sodium component, not the iodine itself. It's the sodium component in that salt that helps that process of getting the iodine into the thyroid cell, into the thyroid, to make thyroid hormones. So the salt, don't be like with sea salt. A lot of people are afraid of salt in general because it can increase blood pressure and all that stuff. But salt is actually needed. It's important if you get the right salt. Like pink Himalayan salt is really, really good. So that's what I like. So and iodine, I think I forgot the name of the doctor, a medical doctor out of Michigan or Chicago. I always confuse the two. And he tested people in that area. 97% of the people are iodine deficient. 97% of the people are iodine deficient. They don't have enough iodine. So if they're iodine deficient, I'm assuming like most people are iodine deficient. And of course, you can get iodine from food and seafood and all that stuff. But there are also some replacements. But you don't need it unless you're deficient in it. And the only way to find out if you're deficient in iodine is if you get tested. Now, this on the left side right there, that's a normal gland, thyroid gland. And if you are iodine deficient, what does your gland do to absorb more iodine?
Enlarge itself.
It gets bigger. It enlarges itself. Goiter. When you see people they get bigger right there. They're iodine deficient, and now that doesn't mean there are some situations. If you take iodine, it's not good for your thyroid gland. But if you have a goiter, and that means your body is depleted of iodine, and you need iodine. So that's where it gets bigger right there. So conversion of T3 and T4 we talked about. Mostly it happens in the liver. So if your liver is busy detoxing your body, because most of the detoxing process happens in the liver. If you have heavy metals, if you have toxins in your body's detoxing through there. So if you're overwhelming your body with heavy metals, your liver is not even have time to convert T4 to T3. So if the liver tries to get that, so we will talk about selenium. To get that conversion from T4 to T3, you need selenium. And that selenium, we'll talk about it, how that selenium, if you have heavy metals, especially mercury could interfere with selenium to do its job, so that conversion could actually cause a problem. So if you have metal fillings, old metal fillings with mercury in there, and we'll talk about that too. But I'll mention that. Go online, I think it's called Smoking Tooth, and you'll find the video of this dentist who actually puts, just like he takes an old tooth with a with mercury fillings in there, and he just rubs it with a pencil sharpener, with an eraser, and you can actually see it evaporates with mercury. You can actually see it, and he equates that to when you actually eat anything, you could actually cause that same thing. And mercury is a neurotoxin that actually damages your body, damages your thyroid, damages a lot of things. And like we talked about, low ferritin, anemic ferritin, that actually could depress that process of T4 to T3. So testing, you need to test to see if you have any heavy metals and if you have sufficient amount of iodine. And if you are familiar, you're gonna have, we're gonna talk about that in a second, about the other, like for example, those heavy metals we talked about. All heavy metals could interfere with the conversion of T4 to T3. But some chemicals or some elements in the periodic table could actually compete with iodine. So iodine cannot get in the thyroid, inside the thyroid, to make hormone, right? So this is not a goiter, but this is a nodule. Like when you start developing a nodule, 95% of those nodules are okay, like they're not cancerous. 95% of them are not cancerous. but 5% are cancer. So if you have a nodule and you go to your doctor, they told you it's not bad enough and it's not serious enough, don't listen. Insist on getting an ultrasound to find out if it's something serious or something concerning. Ultrasound at least to see, oh, they can monitor that nodule, it's not getting bigger. But 95% of them are not serious. But you don't want to be one of those 5% and end up with removing your whole thyroid, for that matter, okay? And that's just, you know, we talked about iodine. It's a big deal. Now, what I need you to do is memorize this periodic table. Did anybody have to do that in school?
Yeah, we were young.
Really? I mean, that was insane. I mean, like organic chemistry and like, I don't know what's the deal with that. I mean, come on.
Many things that we studied when we were young. I don't know why.
I know it didn't make me any smarter. I mean, I still like I was just struggling with the organic chemistry, and on top of that, I need to memorize the periodic table. Crazy. But okay, if you see this arrow right here, you see those like fluoride, chloride, bromide, and what's down here? Iodine. So these are elements that actually competes with iodine from getting into the thyroid. So if you have too much of these in your environment, inside your body, that means your body's gonna act as if it's iodine deficient, because these can compete with iodine from getting inside the cell. So where do we find fluoride?
Water.
Water. Toothpaste. Yes. Yeah. Fluoride. Let's. I think I have a slide right there. Teflon, like cooking. Well, cooking. Yeah. So that has fluoride. Some medications actually have fluoride. If you like wine, unless you're drinking organic wine, wine has fluoride. Does that make sense? And those fluoride actually competes with iodine from getting into your thyroid. Yes, like toothpaste. Like how insane. You see, like right up there, that's I think the back of a Crest toothpaste right there. You see what it says right up there? Drug facts. That means you're actually consuming, you're taking drugs without even knowing that it is quote unquote drugs. And what does it say? The warning: if more than used for brushing is accidentally swallowed, get medical help or call poison control. Now, like, do you think like that's like you know, when you brush your teeth, does some of that actually could be observed? Like, is there like some medications you actually have to put it under your tongue to observe it?
Right.
Now, when you brush your teeth, you probably brush your teeth for at least a minute, maybe 2, maybe 3, and some of that gets observed, but it's not big enough. It's not like, you know, but incrementally with time, that could actually cause more damage. Now, here's the kicker. They said, what did they say? If swallowed, called poison control. Did you know that they add it to water? So the water, yeah, I mean, and it's in water. So like, how could, if you swallow it, called poison control, but we're gonna add it to your water? It doesn't really make sense, right? So fluoride is one of those things. Some communities actually have lobbied out to take it out of their their water. Water source. So
fluoride is healthy for the teeth, right?
Fluoride?
For the teeth?
There is the teeth. So like, you can't see the whitening, like, you know, it makes it white, right? But it actually softens the teeth.
The fluoride.
Yes, the fluoride. In fact, that's why they actually push for it, because it's healthy for the teeth and so forth, but it actually softens the teeth. So there, like, the potential damage of fluoride is
So the only benefit it whitens the teeth?
it does whiten it, but it
That's
softens.
the only benefit?
Yes.
So why did dentists, I mean, when I was a kid and even as a young adult,
Yeah.
I would get fluoride treatments at the dentist that they
Exactly.
and stuff.
Even they would give a special toothpaste.
Yeah.
Exactly.
Yeah.
Exactly. So I had one of my patients, I have not confirmed this, but he talked about like aluminum plants or something like that. The byproduct of that was fluoride, and they didn't know how to get rid of it. So they actually, you know, they invented this way, it's like, you know, on toothpaste, water, as a way to get rid of fluoride. I have not, that's not have been confirmed by me yet, but I just heard that from one of my patients.
They can just throw it.
So why does the dentist tell you when you tell them you're trying to use a healthier toothpaste, and they tell you no, you need to get with fluoride
Yeah.
to prevent cavities. I mean,
Yeah.
what do you?
I know.
They don't know that happens, or
It's a big controversial when it comes to the fluoride issue. It's a big, mess out there. But the best thing is to do your own research. Like I've been using like fluoride-free toothpaste for 7 years, and it's just a lot better for me. I feel better and it's healthier. I know based on the research, the reading I've done, fluoride does not have any benefit for your teeth besides just whitening your teeth, but it actually makes them softer.
Maybe they're just making it out of business.
And there is always like a business,
Everyone likes white teeth, so and they're only concerned about your teeth.
Exactly,
Dentist.
but not
He
your
doesn't
thyroid,
care.
not exactly. Which I wish they looked at the whole picture.
Yeah.
So,
My daughter uses the coconut oil,
Mm.
and she just puts a couple drops of peppermint in it so that it doesn't taste bad. And she swears it makes her teeth whiter.
actually, yeah, coconut oil actually
They
does.
call it something like oil pull, a tablespoon of coconut oil, you put it in your mouth and you just, I don't know. what you
Leave
call
it?
Yeah, no, you just do like this for, like you do with the
Bacteria
mouthwash.
Oh, okay.
Push it, yeah, for about 20 minutes, but people say practical is 7, but it says, it's called oil pulling and it makes your teeth whiter.
Oh, there you go.
Coconut oil.
At
yeah.
least something, and then the benefits of coconut is just unbelievable. Greg, you want to move over here? Because I see the sun
I'm okay.
coming up, creeping up. Bromine, you see that was one of the list, bromine, and that actually also competes with iodine. Now, it's like, do you consume bromine? Actually, if you eat bread, you actually consume bromine. Like in the 50s, I think they used to use iodine to keep the consistency of the bread and to keep it attached together.
Does wheat have bromine?
Meat,
Wheat.
wheat, yes, bread, any bread.
Any bread.
Any bread, and that actually it's in some medications as well, and other places, and mattresses and so forth. So you're exposed to bromine throughout,
But the fact that everyone is having these foods, maybe the lesser quantities are not affecting them.
To repeat that one more, like,
The fact that everyone has fluoride toothpaste, everyone has bread, maybe the quantities are so less that maybe the effect is not being seen or
possibly.
is ignored or.
Yes, possibly. But like, here's the thing: the body is smart, and the body is detoxing through all the time. But like, let's say that you're consuming fluoride and you're using bromide, and you have estrogen is high, and you have your cholesterol is just overwhelmingly high or something like that. Multiple things could impact the body, and then on top of that, you have leaky gut, which leads to autoimmune diseases, and all that could pile up on your body, overwhelming it. So some people could actually get away with fluoride. Some people could get away with eating bread. Some people can get away with a lot of things. You've probably heard of somebody. That's why we're not the same. Like, you probably heard of that aunt or uncle who was drinking and smoking till they were 100, and they were like, they lived good life. But and you've heard about somebody who was 40 and they eat well and they exercise well and they got down with a heart attack. So the body, we're designed to be different. But those are like the things that if your body starts having symptoms, like thyroid symptoms, those
Then
are
you
like the
check
things.
for one.
Yeah, so you need to check for all these things. Yes, Mountain Dew. It has a lot of bromide in it. Yes, that's what it's like right there. Chlorine, water, like, if you go into water and you feel itchy, anything that touches your body absorbs it within 28 seconds. So when you shower in the morning, chlorine in the water gets into your body. And like, that's a big, the skin is huge for potential for those things to get absorbed inside your body. So in that. Also, Splenda is not even a real sugar, but it actually destroys your thyroid. It's actually about 38 different chemicals that are put together to make sugar. Now, when you go to the hospital and you have, diabetes, they tell you to take Splenda, right? But actually, it's a sugar replaced one hydrogen with chlorine. It makes it actually more damaging to the thyroid. So you need to stay away from Splenda. And we talked about heavy metal toxicity, mercury, and we talked like that. I think the name of it, Smoking Tooth video, and you'll see it and it's actually vibrating, and that actually could damage. It's a neurotoxin. It actually could damage your nerve cells, but it also very detrimental effect on your thyroid and the conversion of T4 into T3.
Is that just with silver, or is that with gold also?
With silver, mostly silver, yeah, not gold.
Another thing I'm gonna interrupt and say is,
Go
I
ahead.
have heard that when you buy new clothing, and a lot of people think, oh, it's new, it's, never been worn, what have you, go ahead and wear it. They spray that stuff with all kinds of chemicals and what have you to kill the bugs and all that kind of stuff for shipping and what have you. And they say that if you wear these brand new clothes without washing them first, you will absorb that into your system.
Correct.
So
Correct?
they say
Deborah
wash
agrees.
everything when it's
Awesome.
brand spanking new before you even wear it.
So, and like we talked about, like in relation to lead, mercury, all these heavy metals could interfere with your thyroid function and so forth. Selenium. So to actually convert from T4 to T3, your body needs selenium to have that conversion happen. And that's what mercury actually interferes with selenium. It kind of like competes with selenium in that conversion process. And like we saw, right there. So you have to have selenium, and sometimes you can substitute with selenium and to help with that process. Now, you might be just feeling stressed out just from all the information that I just throw on you, or just from, from me.
Yeah, we have doctors like you and thyroid specialists, so, you can take care of all this for us, right? You can just prescribe and say, okay, yeah, don't take this, don't take this, right?
Yes, absolutely.
You don't
But
have to.
like I said, when you look at anything from the fire department, it's symptoms and medications rather than, okay, let's investigate where it's coming from. Let's investigate where it's coming from. So that's what we're trying to do. So when you're stressed out, chocolate is the answer.
Next week, yeah.
Exactly. And that we talked a little bit about this yesterday, how your adrenal gland impacts your thyroid. If you're like we talked about somebody who can't sleep, somebody who can't get up in the morning, and you have to get to check the adrenal gland to make sure what's going on. These are just more pictures of the same thing. And like we talked about earlier,
Is thyroid related to PCOD symptoms as
it
well?
could, yes.
It could.
Yes, absolutely. What's the leading cause of death in young women, age 20 to 40? I mentioned it earlier. Autoimmune diseases. Autoimmune diseases are the #1 cause of death among ladies between 20 and 40. And like I said, it's not like the body is making a mistake and attacking itself. There are triggers for autoimmune diseases. Let's see what some of those triggers are. Iodine deficiency, viruses, and mercury. Those are some of the triggers of autoimmune diseases. When we talk about viruses, there's some, have you, mono, absent virus? 95% of the people have it, and sometimes you could be asymptomatic, but it could, if it becomes symptomatic, it could cause problems like autoimmune diseases, MS, other problems like thyroid issues as well. So those are the triggers, some of the triggers of autoimmune diseases. There are more. When we talk about autoimmune diseases, what do we test for when we look for autoimmune disease? And this, probably your doctor will never test for it, is the antibodies. The antibodies is the antibodies against thyroid gland. For example, when we look at this lady, when she was tested first, her antibodies were 302 and 66 right there. And theirs are supposed to be less than 35 or less than 30, almost not existing, because that means that you're not attacking your body. And this was her numbers after 6 months of managing her thyroid, managing what irritates and triggers her autoimmune diseases. Because if your thyroid gland is being damaged by autoimmune diseases, autoimmune conditions, first, two things could happen. You could have your thyroid hormones could shoot up high, because your thyroid actually stores thyroid hormones for 100 years. So for 100 days, not 100 years, 100 days. So for that initial destruction of the thyroid, you can actually release all those thyroid hormones into your body, and you think that you have a hyperthyroid problem. But if it's a chronic, now you're not making enough, and you don't have enough thyroid hormones, which could become hypothyroidism. Have you noticed someday you just have a thyroid problem, like you feel like you have hypo, and someday you feel like you're hyper, and that fluctuation happens, that indication of autoimmune diseases. It's not only a thyroid problem, it's an autoimmune diseases damaging your thyroid problem. But the good news is, with the right care and the right supplements and the right monitoring the right way, you can actually reverse that if it's still reversible. Sometimes you cannot, and you just have to manage. If your thyroid is already damaged, sometimes I'm gonna just have to say that. Sometimes you have to manage it with medication. There's no other way. Sometimes there is no other way. But if there is a hope, a chance, it's better, because managing it with medications, it's only for time until it's removed or something done with it. So, like we said, other triggers for autoimmune diseases, but also mimicry for thyroid molecules are gluten and infections, specifically these infections right there, and heavy metals. Those core actually mimic or trick the body to attack the thyroid gland right there. If you have any of these, the only way is to test for it. We don't know until we test for it. And the biggest thing I see with people is getting off gluten. It's like, hey, I can't get off gluten and so forth. But the sad reality is gluten is one of the most damaging things to your digestive system and your thyroid. And getting off gluten would be a big step to start dealing with thyroid problems. So, but the other things could be tested for. And when we talk about, food allergies, for example, like what causes leaky gut is food allergies, and what the scientific term for that is hypersensitivity. And what we're aware of in society, we're aware of this type of reaction, the IgE reaction. The IgE reaction is the one that you have to go to the hospital if you consume too much of it, like nuts or something like that. If you have that IgE reaction in your body, you end up in the hospital. But there are type 2, there is type 3, and there are type 4s. Those are still hypersensitivity that could actually damage your thyroid, cause autoimmune diseases. Does that make sense? So when we look at these, like they sort of cytotoxic, that means they kill the living cells. That's what it means. These sensitivity could actually kill the living cells. And this is an example of a food allergy test that we do in the office to see what foods that could be actually damaging your body, causing autoimmune diseases, and causing thyroid problems. Right
So
there.
how do you test it? You just take a blood sample
Blood
and
test.
test it. That's it. We don't have to keep trying stuff.
No,
Then you take-
that's like a two-year process. You can actually do a 2-year process, and we're almost done. I promise. More than 95% of the people actually consume food they're allergic to, and they don't even know. More than 95% of the people consume food they're allergic to, and they don't know, because your body start developing that inflammation, low-grade inflammation, that it does not flare up, or you kind of like get used to it. Have you heard of somebody's like they live with pain all their life? Like I just get used to it. Same thing with food that you could consume when you're allergic to. It's damaging your body, but now you're used to it because it becomes part of your daily activity or your life, basically. So gluten, you just have to get off gluten. So one of the easiest way to find out if you have any gluten intolerance or if you have any food sensitivity or hypersensitivity is an X-ray, where you can actually see what's going on in your diet. If you're bloated, constipated, diarrhea, all of this gas right there, all this, do you see the stomach, how it's sticking out? All that's just bloated right there from foods that are not supposed to be eaten by this person, and it's specifically for this person. Don't be a non-pooper. Seriously, like, I think the record is a week from the people that I've actually asked, a week. Like, you have to go to the bathroom at least once a day.
Yes.
You have to go to the bathroom at least once a day. And I've heard from other wellness way doctors, they actually had seen people who'd never gone to the bathroom for 2 weeks. They didn't go to the bathroom for 2 weeks. And can you imagine, like, this person, like, just, you have to, like, at least once a day. Really. So, how do we test for it? This is a stool test that tells us what's going on inside your body. You'll see the bacterial infection, the candida, and you'll see all these yeast, H. pylori, and gliadin. That's the protein that you have inside the wheat, and that could cause that gluten reaction right there. And all these things could be tested for, but that doesn't mean everybody has to get, like, it doesn't mean like everybody has to get their heavy metals tested. It doesn't mean that everybody has, like, if you have thyroid problems, definitely get your thyroid tested. That doesn't mean everybody has to get their stool tested, food allergy tested. It's based on what we think is going to get us the best results, the faster. So what is the trigger? We need to find out the trigger. That's the CSI principle right there. And then just low level of acid in your body, inside your stomach, it actually makes, when you have low acid, your stomach does not move. It does not digest food like it should, and now you don't go to the bathroom. You end up with constipation and diarrhea. But if you have low acid level in your body, inside your stomach, what do they give you?
Antacid.
Antacid. What does that do to your acid level in your stomach? So why do you have acid? Why do you get that acid reflux? You have low acid in your stomach, and now your stomach is not digesting the food, and that food is not getting processed and moved, so it's backed up. Now you have acid sticking on top right there, and now you start getting that acid reflux. It's not because you don't have enough acid, it's because you have low acid. In fact, when I have somebody with acid reflux, we give them supplements with more acid, and that helps them a lot more than just their acid reflux medications. Because it's a lack of acid, not too much acid in the stomach. It's not enough acid in the stomach. So gluten and bacteria imbalances of the GI, that could actually definitely causes some of the problems like autoimmune problems and thyroid issues as well. Those are just research articles about gluten and how gluten could actually have a greater impact on your digestive system and your thyroid. And if you need a copy of this, of the presentation, just let me know so I can email it to you. So that way, if you want to dive deeper into this further. Now, if you take a look at, okay, I'm going to go back. If you take a look at these numbers right there, like, you know, we said some doctors would actually be very aggressive and they test for T3 and T4 and TSH. If you take a look at these numbers right there, 1.1, 1.13, 2.4, all these numbers are good. If you're like, if I test your thyroid and I just focus on this, those numbers are good. So that means your thyroid problem or the symptoms that you might be having, the insomnia, the weight problem, the depression, the anxiety, all these problems, losing your hair, all these problems are in your head, and you need to take antidepressant medications based on this, right? But like now, if we go deeper, a layer deeper, those are the antibodies right there. Like remember I said those numbers are supposed to be less than 30? 800. What does that mean? That means the thyroid is being damaged and attacked by the body. And there is a trigger. What's the trigger? Despite what the trigger is, that's what the test looked like after when she was retested. Numbers are coming down significantly right there. So if it, like I said, if it's still reversible, if the process is still reversible, we can. But there's some instincts, some situations where nothing can be done because it's far gone, okay? So, roller coaster ride, that's what I talked about. When it comes to autoimmune disease, sometimes like, I think I have hyper, and sometimes, oh, I think I have hypothyroidism. Sometimes you can't sleep, and sometimes you just can't get up in the morning. And that's what that fluctuation, and if you go with that fluctuation, is you have TSH is increased, doctor is gonna actually give you lower dosage of TSH, or cut it down, and then so forth. Up and down in that roller coaster ride, and your body doesn't know what to do. Let's see what this is all about. We just, for example, like if you look at TSH right there, TSH right there is 0.57. That's low, right? And if you look at the number right there with T4 is 10.4. That's high. But if you look at T3 is free T3 is 2.8, and that's normal. That's normal, and that's the active form of thyroid, right? Thyroid hormone. So TSH is low, yet T3 is normal and T4 is high. T3 should be high. We would expect based on that, but the body doesn't work like that. The body is tricky. I mean, you know, when we know like, okay, TSH is gonna produce like tell the thyroid to make thyroid hormones, but like your T4 is high, but TSH is, and that's because your cortisol level is high, and cortisol interferes in that production, interferes in the conversion of T4 to T3, but also what's more important in this patient's case right there, it actually interferes with the production of TSH. So if you're overwhelmed, if you're stressed out, cortisol could actually interfere with your body production of TSH, even though your your T3 is normal because your cortisol is high right there. It interfering with TSH, so making TSH lower. So attacking your TSH right there, giving you TSH medication to manage that is not going to solve the problem until you find out what's going on with your cortisol level. That's why one of the contraindication of thyroid medication is if you have adrenal problem, not to take that medication. Find out first. Manage this first before you manage the TSH. There you go. High cortisol blocks production of TSH and decrease the conversion of T3 into T4. Just some more examples when we talk about like this lady, 870, the antibodies right there. Her antibodies went down to 170. And her cortisol went down from 16 to 5. Now she is more normal than she was before.